Hi, I'm Brian Mahoney, and in this video, I give you the advice you need for guidance in finding the right job or career opportunities for you. Use this info to help in your career development or to maybe take a different career path. I will be posting all types of careers to choose from: freelance jobs, work from home jobs, government jobs, and federal jobs, and much, much more. So, subscribe, and share with all your family and friends who could use a little career counseling. Today, I'll show you how to become it. Next, we quickly cover the work environment. Third, you'll learn how much the pay or salary is. And finally, and maybe most importantly, what is the job outlook for this occupation? So, let's get started.
How to become a respiratory therapist. Respiratory therapists typically need an associate's degree in respiratory therapy. Some employers prefer to hire candidates who have a bachelor's degree. Respiratory therapists must be licensed in all states except Alaska. Requirements vary by state. Education. Respiratory therapists typically need at least an associate's degree in respiratory therapy from a program approved by the American Medical Association, such as those accredited by the Commission on Accreditation for Respiratory Care, COARC. Employers may prefer that applicants have a bachelor's degree. Some programs require applicants to fulfill prerequisites. High school students interested in applying to respiratory therapy programs should take courses in biology, algebra, chemistry, and physics. In addition to respiratory therapy programs offered by colleges and vocational technical institutes, a COARC accredited program in the armed forces leads to an associate's degree. Respiratory therapy programs typically include courses in human anatomy and physiology, and therapeutic and diagnostic procedures and tests. These programs also have clinical components that allow students to gain supervised, practical experience in treating patients. Licenses, certifications, and registrations. Respiratory therapists are required to be licensed in all states except Alaska, where national certification is recommended. Licensure requirements vary, but usually include passing a state or professional certification exam. For specific requirements, contact a state's health board. The National Board for Respiratory Care, NBRC, is the main certifying body for respiratory therapists. The board offers 2 levels of certification: Certified Respiratory Therapist, CRT, and Registered Respiratory Therapist, RRT. Candidates typically sit for the CRT exam. After successful completion, CRTs may take an additional exam to earn RRT certification. Some employers require that candidates earn RRT certification before being hired or within a specified amount of time on the job. Important qualities. Compassion. Respiratory therapists should be able to provide emotional support to patients undergoing treatment. They must be sympathetic to a patient's needs. Detail-oriented. Respiratory therapists must stay focused to ensure that a patient receives appropriate treatments and medications. They must be meticulous about monitoring patients and recording information related to their care. Interpersonal skills. Respiratory therapists interact and build relationships with patients. They often work as part of a team and must be able to take direction from others, such as a supervising physician. Patients. Respiratory therapists may work for long periods with patients who need special attention. Problem-solving skills. Respiratory therapists must evaluate patients' symptoms, consult with other healthcare professionals, and recommend and administer the appropriate treatments. Work environment. Respiratory therapists held about 135,100 jobs in 2020. The largest employers of respiratory therapists were as follows: hospitals, state, local and private, 82%. Nursing care facilities, skilled nursing facilities, 4%. Offices of physicians, 2%. Respiratory therapists work in various areas of a hospital, including emergency rooms, critical care units, and neonatal intensive care units. Respiratory therapists may stand for long periods and may need to lift or turn patients. Injuries and illnesses. Like other healthcare workers, respiratory therapists may be exposed to patients who have infectious diseases. They may also experience strains or sprains when lifting or turning patients. Because of this, they must take precautions to minimize their risk of illness or injury. Work schedules. Most respiratory therapists work full-time. Because they may work in medical facilities that are always open, such as hospitals, they may have shifts that include nights, weekends, or holidays. Pay. The median annual wage for respiratory therapists was $61,830 in May 2021. The median wage is the wage at which half the workers in an occupation earned more than that amount and half earned less. The lowest 10% earned less than $47,380, and the highest 10% earned more than $95,540. In May 2021, the median annual wages for respiratory therapists in the top industries in which they worked were as follows: hospitals, state, local and private, $61,940. Offices of physicians, $60,570. Nursing care facilities, skilled nursing facilities, $60,570. Most respiratory therapists work full-time. Because they may work in medical facilities that are always open, such as hospitals, they may have shifts that include nights, weekends, or holidays. Job outlook. Employment of respiratory therapists is projected to grow 23% from 2020 to 2030, much faster than the average for all occupations. About 10,100 openings for respiratory therapists are projected each year, on average, over the decade. Many of those openings are expected to result from the need to replace workers who transfer to different occupations or exit the labour force, such as to retire. Employment. Growth in the middle-aged and older population will lead to an increased incidence of respiratory conditions, such as pneumonia, chronic obstructive pulmonary disease, COPD, and other disorders that can permanently damage the lungs or restrict lung function. The aging population will lead to an increased demand for respiratory therapy services and treatments, mostly in hospitals. In addition, a growing emphasis on reducing readmissions in hospitals may result in more demand for respiratory therapists in nursing homes and in doctors' offices. Advances in preventing and detecting disease, improved medication, and more sophisticated treatments will also increase the demand for respiratory therapists. Other conditions affecting the general populations, such as respiratory problems due to smoking and air pollution, along with respiratory emergencies, will continue to demand for respiratory therapists.
Job interview? There's no stress for you. Just excitement that you will crush your next job interview with confidence and ease because you have the audiobook Job Interview Prep Book for men, women, and teens. You'll be able to answer the tough questions and handle your interview with confidence and ease. And right now, Amazon and Audible are offering a free trial. But don't wait. You'll wait your life away. Just hit the link in the description and get started right now.